What if the treatment of cancer means that you don't have to destroy your body with chemicals? What if the treatment of cancer is replacing things that are missing in your body? Hmm. But if we look at what I just said about adding beneficial ingredients to your body, for lack of a better word, then how can you deal with the most aggressive therapies? Do you deal with it with more chemicals, or do you stop and say, okay, what do I need to do to starve the cancer as opposed to feed it so that it grows? But we want to starve it. What if you can do that without harsh chemicals? Well, today we're very grateful that we're going to be hearing from Dr. Henning Saupe. He is a doctor for the founder, the pioneer of integrative oncology at Arcadia Clinic. And by the way, I have known about Arcadia Clinic since I started the radio show back in 2011. So Dr. Henning and I, even though we didn't know each other, I knew of him. And so I'm just so grateful that I've had the opportunity to not only learn about the clinic, but now to get to know about how he is helping people with cancer, with, you know, sent home because you're not the maybe the medication or whatever you're doing is not working. And all of a sudden something clicks, or maybe somebody just gets a cancer diagnosis and they learn that instead of choosing for chemical therapies that may or may not work for them, what about taking a pause and learning about what does the body need? What are the deficiencies? Well, that is why I'm so excited that Dr. Henning Saupe is here. He is the author of the Holistic Cancer Medicine book that we are giving one away today for you. I just want all of you to understand that there is more that we don't know, we don't know. Now, last month, like I said, last month, this is kind of like part two, because last month we started talking about mistletoe therapy and also hyperthermia. But then we just basically just talked about metabolic support. But this could be the key, where Dr. Henning says could be the key to starving and creating a better um, terrain in your body so that you can heal. And so get your pencils, get your papers, because we are going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show Classroom. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening, as well as my viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Now, I've been looking forward to all month to have this conversation with Dr. Henning because last month we talked about mistletoe therapy. And listen, mistletoe is always in my foyer since I've owned a home, because you kissing is always so wonderful, and that's where, you know, what happens under the mistletoe stays under the mistletoe, which is a sign that I have in my foyer in my home. I truly believe that mistletoe is like an excuse to just give each other a hug or a kiss or whatever, but what if it has healing powers? I want to encourage you to listen to last month's Dr. Saupe's podcast that we did, and it was amazing. We also talked about hyperthermia. Who knew that having a fever was going to be so informative to the body? So today we're going to focus on the metabolic support. I want to encourage you to go check out last month's video, because you will learn more about other non-toxic therapies that will support your life. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Henning Saupe is here to do just that. Welcome back to the classroom, Dr. Saupe.
Hi, Lily. What a pleasure to see you, and I'm excited to having this conversation with our audience and with you. And thank you for having me again.
It's my pleasure. And I want to encourage you to text me at 407-373-5959, or you can email me at lily@whenyouneedafriend.com. If you live in the United States, the book will be sent to you for free. But if you live outside the country and you want to participate in the book, then you just need to pay for the shipping, and I'll let you know what that is. But text me at 407-373-5959. A week from today, I will pull a name out of the winner's basket, and I will let you know if you win. But this is a holistic cancer medicine approach. Why did you, Dr. Henning, write this book?
Well, because I felt it's necessary. It's necessary to spread the knowledge of my 30 plus years of being in this profession as a medical doctor and as somebody who tries to find new ways to help people that have received a cancer diagnosis and suffer and live with cancer. Cancer that is such a complex disease with so many different facets that we all need to learn more about this disease that, by the way, is something that every second adult soon will hear from his doctor that it's happening in your body. The number is not nice to hear, but that's a good motivation to continue to listen to our show and to the other shows that you had with knowledgeable cancer doctors. The lifetime risk at the moment is around 40% to be diagnosed with cancer. And the scientists tell us that in about 15 years, the lifetime risk will be more than 50% for everybody in the Western world. So that's the reason why we have this show today, where we talk about cancer today. And that's the reason why I published my holistic cancer medicine book some 3 years ago. So it's the summary of what I learned the last 20 plus years in my life as a medical doctor, what cancer is. And I studied medicine in the 80s and 90s in Germany and received a doctorate and got my license as every medical doctor in my country. And what I learned at my university was a very limited understanding and a definition of what cancer is. It's a growth of cells that should not grow, that eventually form a ball in your body, and this growing ball threatens your life by compressing life important organs and vessels, and it creates pain, and all you can do is to try to kill it and get ahead of it by killing it with poisonous substances and radiation, and at the beginning you need a surgeon to cut it out. So, and if you're lucky enough, you were diagnosed at an early stage so that the surgeon can cut it out entirely, and then you're done, and that's all you can do. So this is what I learned in essence, and what medical students still learn in Western world universities. And it's not entirely wrong, but it's an incomplete description of what cancer is. We call it the reductionistic interpretation or version of it. It reduces the very complex phenomenon that a human body suffers from this disease to a thing that we want to eliminate and cut it out and poison it. And that is the Western world approach. That is incomplete. So I learned that what you eat matters, how you sleep matters, how much you exercise matters, your body weight matters, your mental balance and mental health matters, because that is connected to our immune system. And the immune system matters a lot because at the end of the day, it's our immune system that keeps away cancer and helps us to not developing this disease that lies in disguise in every human body. It's another fact that I learned the last 20 years that is explained in my book, that cancer cells are in essence not foreign to the human body. In fact, there are cancer cells in every human body at a very, very low grade. And if you follow my thoughts, you can eventually understand that not having the disease means to be in control of a very small number of cancer cells that exist in my body, behind the curtain in disguise, and I don't call it a disease because I'm not aware of the fact that there are some 1,000 cancer cells somewhere lingering in my body, and it's my immune system that keeps these cells at bay every day in my life as long as I live. So that brings us to the concept of living in a happy, healthy way that keeps cancer at bay and changes the perspective that cancer is not anything that you need to cut out and poison all the time. You need to be in control of it, and that's a totally different approach. And that's what you told the audience already in your introduction, that the metabolic approach is about keeping the small number of cancer cells at bay in an organism that thrives and is strong and lives a long and happy life with the natural burden of a few cancer cells that live somewhere in my body under the control of my healthy immune system. So, and this new understanding, as I would like to call it, that took me years to get from all the articles and books that I read the last 30 years in my life, enabled me to interpret the challenge of cancer in a totally different way. That means the metabolic conditions in my body need to be on a level where I can live with cancer that is under control, instead of feeding cancer so that it develops into a disease that threatens my life. And the reductionistic approach is not all wrong. A growing cancer at the beginning of the disease needs to be treated surgically in most cases. If it's a solid tumor, like most tumors are, they're the liquid tumors. We call them leukemia or blood cancer. It's a little bit of a different story. Yeah. But if we say cancer today in this conversation and mean a solid tumor, a solid growing mass of cells that form a tangible tumor, and we talk about the carcinomas, the solid tumors, I totally support the recommendation to cut it out at an early stage so that we don't go into any misunderstandings today. I'm not replacing surgery with my view on cancer as a metabolic disease, but we know that more than 50% of all cancer patients cannot be cured with surgery. That's a fact that you can find in the literature. So in these 50% of all cancer patients that cannot be treated in a curative way through a surgical intervention, we need to acknowledge that cancer is a metabolic disease that responses to metabolic changes in my body, to the good or to the bad. And if I wake up one morning and the doctor tells me it's cancer in your body and sorry, it's metastasized, there is no way to cure you with surgery, then I should wake up and say, what went wrong in my body? Why does my body allow these cells to grow that should not be in my body, and at least they should not be growing? And the book, to answer your question, is what I learned the last 20, 25 years as the potential answer to this question. What went wrong in my body so my body could not keep the number of cancer cells under control, but allowed these cells to grow and form a lump and form eventually metastases, daughter tumors that go everywhere in my body. So, and it took me around 300 pages to summarize my knowledge, what we know about the factors that change my body's ability to control cancer into the disease that we call cancer, where the control is gone. And many of the factors that I describe in my book and that I apply in my treatments here at Arcadia Clinic in Germany address the metabolic surrounding and not only the tumor. The tumor is like the top of the iceberg. And we know, if we use that analogy, that what we see if we look at an iceberg is only 1/6 of the iceberg. 5/6 are underneath the sea level. So if we only chop off the peak of the iceberg, we do not acknowledge the fact that there are 5/6 hidden below sea level. And that applies very well for my approach to cancer. If we only look at the tumor and try to poison it, we miss everything that made the tumor grow and made it happen. And that's the metabolic imbalances in my body that I need to address with the therapies and lifestyle changes and diet and metabolic therapy. So this is my first answer to your question.
No, it's great. And I want to encourage if any of you are thinking about trying something different and new, you've been diagnosed with cancer, and you would like to consider going to Arcadia Clinic, feel free to text me or email me and let me know, and I'll get you a 45-minute free consultation with Dr. Henning. I'm really excited about that because you only get that here. So I wanted to when we hear about metabolic, it's a word that's relatively new now. We've heard of cancer for such a long time, and it is amazing when I hear you speak of metabolic and support and all of that. It makes so much sense. But when we first are told about cancer, we're fed an education that, like you said, is not complete. I love how you said that. Like, okay, you can have surgery, and I'm not saying you can't have surgery, but if surgery alone will not do it. But I know there's a lot of people that have had surgery alone and don't do chemotherapy, don't do radiation. In a situation like that, was surgery necessary? Could a metabolic approach have reversed that cancer if they would have left it in the body?
The metabolic changes need to be addressed in a holistic complementary treatment approach so that the risk of a reoccurrence goes down.
Okay.
Why does cancer threaten our lives? Not because of the primary tumor that we call the mother tumor, or the part where the tumor starts to become visible. The fact is that the threat to our life comes from the metastases, the daughter tumors that loosen from the mother tumor and go everywhere into our brain, into our liver, into our lungs. And that is the reason why people die from cancerous diseases. So the question that we need to find an answer to is, why does the body allow these cells that spread from the original mother tumor to go to the organs, and where is the defense? What happened so my immune defense that is supposed to kill cancer cells at an early stage of their life fails and allows them to go to the organs? And that is, again, the answer to this question lies in the understanding of my metabolism. So what is metabolism? It's the many, many million biochemical reactions that happen in our cells every second. All this together, the phenomenon of life, how substances change their shape in our body, how food that we eat and the air that we inhale is transformed into viable energy and biological cells that create the beautiful body that gives me my physical tool to live my life here on earth. That is called metabolism, the changes of biochemical substances, the ever ongoing change of and transmutation of food into living matter and living cells. And so the whole thing that happens biochemically in my body is called the metabolism. And this metabolism can, if we summarize it in a simplified version for our audience today, that fills a medical study 6 years, and after the 6 years you're still not done, you study it for the rest of your life. That's how complicated the human metabolism is. But allow me to simplify it a little bit. This metabolism can be done in two ways. In the ways a healthy cell does it, and then it happens in the vicinity of oxygen. Our cells love oxygen. That's why we need to breathe. We're not plants. We need oxygen. A plant gives us oxygen and needs carbon dioxide. We are the opposite. We exhale carbon dioxide and we need oxygen. And in the vicinity of oxygen, a healthy cell is able to transform the food that we ingest into viable energy. And that happens. I have a little model here of a cell. This is a model of a human cell. And by the way, our body is made out of 100 trillion cells. And they all look more or less the same, like this model. There is a cell nucleus, there's a cell membrane, and there is a liquid inside the cell that contains all the organs of the cell that are called organelles. And every cell that we find in our body and in the body of animals needs oxygen and turns oxygen into energy in these little structures that we call mitochondria. It's a funny name, it's a Greek name for this little compartment, looks like a little bean inside the liquid of an animal or a human cell. And by the way, a cell in my body contains between some 100 and some 1,000 of these mitochondria per cell. And that's where the metabolism takes place that transforms our food together with the oxygen that we inhale into viable life energy, called ATP if you want to have a biochemical term, adenosine triphosphate. And that is the healthy metabolism in a simplified version. So now we speak about a cancer cell. What does a cancer cell? A cancer cell is a little odd. It has a damage in the mitochondria, and it has lost the ability to use oxygen and produces much less viable biochemical energy than a healthy cell. And as a fact, as a consequence of this metabolic damage, of this damage to not utilize oxygen and produce a lot of biological energy with oxygen and the food we eat, it goes down to approximately 1/18 of the efficacy of a healthy cell. So it has a massive metabolic damage. And with so little biochemical energy, the poor cell has two choices. Either it dies completely, and that would be a blessing, or it activates an emergency program that we call cancer that keeps the cell alive with so little energy, but makes it an autistic, egoistic cell that does not listen to the needs of the human body and tries to survive on its own at all costs. And that is cancer in a simplified version. So cancer is the behavior, or the cancerous behavior is a behavior of a cell that has a massive energy problem and a metabolic damage. Next question is, where does the metabolic damage come from? And that opens a new chapter. It comes from toxins. It comes from too much inflammation. Somehow our body, and as we age more and more, develops too many inflammatory activities. We react with inflammation to the pesticides, to the toxins in our food, to the lack of exercise, to the natural process of aging. The more we age, the more we involuntarily produce more inflammatory activities in our joints, in our muscles, in our tendons, in our arteries. And this adds up a burden, a biochemical burden that damages some cells bit by bit to the level where the cell falls into this emergency program called cancer because of a lack of biological energy that it can produce. And again, if we want to use the word metabolism, it's a metabolic process, or a process that happens within our metabolism that eventually, step by step, turns the normal change of biochemical energy in the vicinity of oxygen with an efficacy to produce a lot of energy that healthy cells need to stay healthy, down to a life form that reminds us to life forms that we find in very, very simple life forms like amoeba, the single cell life forms in ponds and in the sea. And that biologists tell us that this was the beginning of life some 3 billion years ago, when there were no higher developed animals, but only single cell life forms. So cancer goes back in evolution to a very primitive, but kind of successful survival mode that does not need oxygen, but sorry, it does not cooperate with the rest of my body. It becomes an autistic, egoistic cell that just grows. And the reason for that is a change in my metabolism. So now I explain some details, the most important details, why cancer is a metabolic disease. And we need to go to the roots of this metabolic damage and create an organism, create a biochemical environment in our entire organism that protects the healthy metabolism, that allows cells to stay healthy and utilize oxygen and produce enough ATP in the mitochondria. And by doing that, we prevent cancer. So when the diagnosis is there, when a patient is diagnosed with manifest cancer, we need to do two things. We need to take care of the imminent risk of a growing tumor that threatens one's life, and we need to look for good surgical techniques to hopefully get it out of our body as soon as possible. Sometimes we need radiation. I think about brain tumors or childhood tumors in the spine. So there are definitely corners in the complex world of oncology where I welcome the most modern and most effective anti-cancer therapies to start with. But at the same time, we should try to repair the organism's metabolic system, the metabolic aspect of cancer, and make sure that we do everything to support the healthy life form and prevent reoccurrences. And that is my daily work with patients who come to the Arcadia Clinic here that I run in Germany, that come with metastasized forms of the disease where the surgical approach is not working any longer. If you have many metastases, modern medicine tells you that surgery has very little to bring to the table because the disease is spread to many parts of your body. And in that chapter, and again, it's more than 50% of all cancer patients who are in this situation right from the beginning, where surgery does not give them a cure any longer. They need to work on their metabolism. They need to work on the terrain in their body so that the cells switch on the energy production in the mitochondria that helps the cell to live in the vicinity of oxygen, producing enough energy so that it can keep its mature, cooperative cell life alive and does not go into the cancer mode. And this is now the explanation for why we work on so many sides, on so many aspects in the body, like diet, like gut repair, like mitochondrial repair, like detoxification. And in my book, you find a chapter for all these headlines that I just mentioned. How about detoxification? How comes a regular oncologist does not speak about the detoxification? It's a phenomenon that still surprises me after all these years. My patients tell me the story over and over again when they ask their oncologist, and okay, you give me some toxic drugs. I understand why that might be necessary, but how about detoxification? Oh, that's not necessary. Oh, we don't do that. Your body does that, and there is nothing to add. That's completely incomplete. That's against science. No, in no other realm in the world you would behave like that and use a toxin to accomplish a certain change and not care of the debris, not taking care of the leftovers of the toxins. But surprisingly enough, my dear colleagues who are so knowledgeable in their specialties show no interest in helping the patient with detox protocols. And that is one of the big topics, the big themes that we help our patients with here at Arcadia Clinic to detoxify more properly. The damage after chemotherapy can last for years, if not for the rest of your life, if you don't care for proper detoxification.
And also put you at a level where you'll have a cancer recurrence if you don't detoxify.
Yes.
I mean, I the visual that I get, I remember Dr. Lee Cowden, who's been a regular in the classroom. Dr. Lee Cowden always talks about a tub. If you had a tub full of mud and you start putting clean water in it and you do not take the plug out, then you're going to have a full muddy tub of water. And so he says it's so important to take the drain and drain all the mud out and start putting the clear water and the healthy water into the tub so that now the tub has a chance to you'll be able to be in a clean tub of water. And so I always get that visual when people talk about, we don't need to detoxify. We don't need to detoxify. The body detoxifies automatically. Well, what they don't say is that you need to be asleep between the hours of 10 and 2, for example, so that when your organs start detoxifying, or when they shut and start detoxifying, each organ starts going through that process. I think it's called catabolic state. When it starts going through that, you must be asleep. How many people are up till 2 o'clock in the morning,
Yep.
and
And that
they're not going
destroys
to
their
bed?
circadian rhythm and their detoxification capacities.
Correct.
And
And even
nature
that's
and
not
God,
enough. Yeah.
yeah, gave us detox minerals that are necessary for the production of detoxifying enzymes and detoxifying molecules, antioxidants in our body, like selenium, iodine, omega-3 fatty acids, vitamin D3, etc. But in the totally artificial scenario of a chemotherapy that goes through my body, my needs for these trace elements and detoxifying molecules 10 doubles, and nobody can eat buckets of blueberries and raspberries and
Broccoli. Yeah.
papaya every day. So we need to find ways to get these detox minerals and vitamins and trace elements and plant-based antioxidants in a condensed form. That's what we call nutritional supplements,
Yes.
essential for patients who go through chemotherapy and want to recover from the toxic side effects.
Very
And that's
good.
another splendid example for the necessity of complementary medicine. We're not in opposition to standard medicine, but we have to bring, we have so many things that we can bring to the table that, together with the modern drugs that we sometimes choose very, very carefully, individually adapted to the patient's needs and the patient's biochemical details, that we wrap these therapies in a holistic primer and help the patient to detoxify better, to have a healthy gut flora throughout the courses of chemotherapy. When I studied medicine, my academic teachers ridiculed the concept of gut repair with probiotics and fermented food. And now, 30 years later, you'll find in no time tons of articles that
It takes a
support.
long time to change the mind of the
It
people. It
takes,
takes 20 years to learn how to wash your hands.
yeah,
I remember that doctor in Austria, I believe he was an Austrian, that, he realized that, when he went from the morgue to
yeah.
the birthing
Dr.
room.
Semmelweis in Budapest, Hungary, was that. They had
Oh, is that Hungary? That's right. That's right. It took 20 years, and he was laughed by his colleagues.
It was
But,
dismissed. He was
yes.
kicked out of the hospital when he claimed that doctors should wash their hands when they go from pathology to the department for newborn babies. And when doctors started to wash their hands, the death rate of newborn babies dropped to almost zero. And as a consequence of this splendid idea, he was dismissed from the hospital.
I know.
And you know
So it
what
takes
the
time.
university clinic in Budapest, Hungary is called today?
What?
It's called the Semmelweis University. So it
Oh,
took only 150 years
yeah.
to
Yeah.
change his
But
reputation.
in the meantime, these people that are the trailblazers are the ones that are suffering the most. And when I hear you talk about this, I'm like, this makes total sense. But to someone who's been taught the incomplete story, it is so foreign. And I had to learn these new truths. And that's why, and I'm going to take a little shift here, because I want to talk about the classroom and how important it is for you to grow with us. Go back and watch some of the classes. That's why on Mondays and Tuesdays and Fridays, I have some of the past classes in the classroom, because it's so important that we build together. Because I didn't just show up today and understanding Dr. Henning Saupe. It took me, I mean, I've been at this for 14 years. Actually started learning about it in 2015, started the show in 2011. So from 2011 to 2015, I was like going, this doesn't make sense anymore. Let me dig deeper. And this is what I'm asking you today. I want you to dig deeper. If what I'm saying and what Dr. Henning Saupe is saying, I want you, it doesn't make any sense. I want you to be curious instead of critical. I want you to say, why is it that when somebody is sick, we add chemicals that the body doesn't recognize as nutrient or food to make them better? Where is that written in anywhere that it makes sense? It did because we were taught it made sense. But if we sit back and just say, you know what? I want to learn some of these new truths. Go to whenyounneedafriend.com. Check out the conversations there. We've been having them for 14 years. And even when I didn't understand it, I would have people so that so they can talk about these new truths in the classroom. And let me tell you, I had to relearn to speak a new language. And even though you may say, oh, I understand what you're saying, we may not understand what it means. What it means, what Dr. Henning is talking about is so crucial to our health. And so I want to encourage you to go to whenyounneedafriend.com, check out every single conversation we've had about cancer or about natural cures or natural reversals or reoccurrences, removing them and all those things. Start being an MD, your own MD, your own medical detective, and try to rewrite the story and the programming so that you can say, okay, I may have a deficiency. What does that mean? Okay, so go to whenyounneedafriend.com. While you're there, please subscribe to the website. Make sure you share this video with everybody. Let them know that Dr. Henning is in the classroom. We're giving away his book today, that you can find him in Germany. You can get a 45-minute free consultation through just reaching out to me, email me, or text me at 407-373-5959. You can either request the book or you can request 45-minute free conference, and I will hook you up with Dr. Henning and his staff because he is amazing. I wouldn't be having him in the classroom if I didn't totally believe. And as a matter of fact, I want to do an internship with him. I'm going to keep planting that seed until he goes, enough. Okay, come and visit me. Okay, so with that in mind, please also like and follow me on all social media. Check out the programs there. Check out the shows that didn't make it in YouTube that were, I'm telling you, I've had 90 shows removed from YouTube because this information is being suppressed. How do we get it to get out there? I need your help. I need for you to do everything you can to share this information because you will know someone in your lifetime, if not more than just one person, who will either be diagnosed or die from cancer. So I want to encourage you to stop the madness by learning these new truths. Now, also check out my sponsors, the way that they're supporting the classroom. When you go to whenyounneedafriend.com, there's a new facelift in town. So check out the facelift for my website so that you can see it's a little bit easier to maneuver and be able to find the different things that we've done in the past. Also, you can become a student in the classroom, whether it's $1 or $1,000 a month, a one-time donation. Help the classroom grow. Another way you can help us grow is by going to the Shop Now bag. These are Lilly approved products from head to toe, from beauty products to pain management, which is all natural, it's non-invasive, and you'll go, I didn't realize that I could feel this good. So join us at whenyounneedafriend.com. Share this conversation with everybody that you know, because it doesn't matter how educated you are, how wealthy you are, how well meaning you are as far as rest and all the stuff that Dr. Henning is talking about. All of us is going to face this at one point or another, whether it's you or someone else. So I want to encourage you to be proactive and be about prevention as opposed to having to reverse this. Once again, Dr. Henning's book is Holistic Cancer Medicine. It's an amazing book, and you can get one free. Just text me, email me, or text me and let me know that you would like a copy of this book. I will I put your name in the winner's basket. So if you're listening on podcast, you too have an opportunity to get a chance to put your name in the winner's basket and get your own book. Today, we are talking to Dr. Henning Saupe, and he is in Arcadia Clinic. All the information, if you are a subscriber, all his information, the information for the book, the information for his clinic, the information for him, that's all in the blog. So if you are a subscriber, you already have this information. But so just go there and if you just subscribe. That's all you need to do. Subscribe and opt in after that. So today, Dr. Henning could be anywhere. He could be relaxing, having his tea, having a piece of chocolate, which we know has caffeine in it. And that's a private joke between us. And so what I'd like for you to do, Dr. Henning, today is, how, I mean, you've talked about metabolic approach and how important it is, and for, how to put the nutrients that we are deficient in. How do you assess what each individual needs? Because there's the spiritual component, there's the physical component. How do you at Arcadia Clinic assess this? And by the way, I want to share something. I have priced other clinics before. A trip to Germany and staying at Dr. Henning's clinic is cheaper than going outside of the country to Mexico or going to other clinics, even in the United States of America. And so I just want to put that plug in because it is true. So Dr. Henning, so how do you assess the importance of where do you start targeting this individual cancer with the person, not the tumor?
Well, we do an in-depth assessment with tons of laboratory tests. We do tests to find out on what level the patient's inflammatory activities are. We check vitamins, we check trace elements, we check heavy metals. We do a urine analysis to find out if there is an overproduction of some inflammatory components like leukotrienes that we can block with certain agents if they are on a higher level than normal. We do a microbiome analysis. We check the balance between the vegetative nervous system, the parasympathetic and the sympathetic, with a so-called heart rate variability test. We do a live blood analysis with a dark field microscope that allows us an immediate to get an immediate impression from a drop of blood taken from the tip of the finger on the patient right under the dark field microscope. And we show the patient how the cells look like, if there are signs for inflammation or clogging of blood cells. We can address with enzyme therapy or with vitamin E or with omega-3 fatty acids that reduce the stickiness of blood cells. So we do a lot of assessments, a lot of laboratory tests and physiological tests. We do a physical examination. We use ultrasound to look into the organs, and we want the patient to come with a new set of radiology examination results like CT scan or MRI or PET scan if necessary. So we want to know as much as possible what's going on in the patient's body with all kinds of tests. And from there, we know what the patient needs, what trace elements need to be supplemented, what vitamins need to be supplemented, what heavy metals need to be detoxified, how intensively we need to work on anti-inflammatory therapies to reduce the inflammation that is more or less always connected to malignant diseases. The term has already been coined that cancer is a malignant inflammation. So there is always an inflammatory part of a carcinoma, of a sarcoma, or of a neoplastic disease, a disease that we treat in oncology. So first answer, we do a lot of tests, physiological, laboratory examination on all levels to find out the patient's needs. And then we pick the treatment tools from a variety of realms. And in holistic medicine, we use dietary changes, we use anti-inflammatory food, we use food that is high in plant-based components to balance the acidity and the alkalinity that is in most cases shifted into an over-acidity in patients who live with a standard Western world diet that is too high in animal-based food and too high in acidic components. So we need to balance that with plant-based food. We reduce sugar. Metabolic therapy is a lot about mitochondrial repair and the reduction of sugar. Sugar, wow, we could have an hour about sugar alone. Let me drop a few numbers.
And we will. Maybe this will be part 3.
Yes. So let me drop a few numbers. You can find in textbooks that around 120 years ago, the consumption of added sugar to the food was around 2 pounds per year per person. Today, we are at 200 pounds added sugar per year per person. So we 100-fold raised the intake of refined artificial sugar to our food. No question that that has changed our risk for chronic diseases like arthritis, high blood pressure, diabetes, obesity, and at the end of the road, cancer as the ultimate consequence of a metabolic disease. So we need to work on the sugar uptake. We need to reduce sugar drastically. We need to learn what glycemic index and glycemic load means. You can learn that in my book. That's how fast our body transforms the food we eat into plain sugar. There's a number for each food item, and that is called the glycemic index. The glycemic load is about the volume or the masses of sugar that we get, the weight, the number of sugar. So glycemic index is more how fast we transform food into sugar, and glycemic load is the amount of sugar. And we need to reduce that on both sides and learn what it means to eat and live with a low-carb diet. There is a very special diet called ketogenic diet that is so low in carbs that our liver starts to produce certain biochemicals that represent an extra source of energy for our brain. Those chemicals are called ketone bodies. It's a very, very special chapter that I just want to touch in our conversation today. For some patients, that might be a good strategy to live on for a certain period of time, like some months. Some patients choose to live on a ketogenic diet for a long period, and for some patients that works really well. But for other patients, it might not be the optimal diet. And this is to find out between the doctor and you if you are a candidate for a super low carb diet that is called ketogenic diet, which is around 10 to 20 gram carbs a day, which is almost nothing. Or if you are a body type and in a situation and in your constitution is a constitution that makes you somebody who thrives best with a low carb diet, which would be around 100 gram carbs a day instead of the average 400 grams. That is the standard American diet. It's around 400 grams. That's almost 1 pound of carbs a day, which is too much. So cancer is very often a consequence of a lifestyle with too many carbs, and obesity and diabetes or pre-diabetes are definitely risk factors that we need to address as soon as they show up, to not go into the risk of developing cancer as the next step of the body's response to this metabolic mismatch. Then we have all the drugs and remedies, both from natural sources and synthetic drugs that work on our metabolism, that are described in my book, that help us to have a moderate up and down of the curves of blood sugar and insulin production in our body. Let me mention natural components that we can use to have a more healthy up and down of blood sugar and insulin, like cinnamon. Cinnamon helps us to have a moderate modulation of our blood sugar ups and downs. Or berberine, which is a plant extract that is similar to the synthetic drug called metformin. Metformin is a known drug for diabetes patients, and by the way, a repurposed drug for cancer patients. It's a special chapter, how we can use synthetic drugs out of the box in a new context, and those drugs are called repurposed anti-cancer drugs, and it's a number of between 30 and 40 drugs that I use from this toolbox called repurposed drugs that are designed for other diseases but can be used to treat cancer patients. And I give you a few more examples. Ivermectin, an anti-parasite drug, or mebendazole, another anti-worm, anti-parasite drug, have shown impressive properties in the treatment of metastatic cancer, with very little toxicity, and something that many patients get a huge benefit from as an add-on therapy. I have to warn our listeners that there's some sites online that make you believe that that is the cure of cancer. I would never say that these anti-parasite drugs have the potential to once and forever cure cancer, but they may be worthwhile taking as an add-on to lower the risk of progressive disease and to
Yep.
prolong your life with a very good quality of life. And another factor that is important for many patients, at a very reasonable cost. We have not talked about the costs of modern drugs in our conversation today,
No, and
which is a concern. In countries like the USA, we're ready to spend $300,000 to $400,000 per year in drugs to
yep.
keep a patient alive, not to cure the patient, but to keep the patient alive for another year. And that it becomes more and more expensive. Drugs enter the market with astronomical costs. A CAR T cell therapy, just to drop another name, costs about $1 million nowadays. And well, somebody has to pay the bill at the end of the day. And the drugs that I mentioned and the drugs we use here are really reasonable in their costs compared to these super expensive modern drugs that still have not shown us that they have the potential to cure cancer, but
Yeah.
just help us to stay alive
Yeah.
for a period of time.
And
So,
Dr. Henning, are those treatments that you're doing? Because I know that there's Americans are used to being nickel and dime, and I know you talk about the cost. We've talked about this before. I've talked about this with other doctors too, that sometimes we allow our insurance to dictate what kind of therapy we have because we don't want to have the out-of-pocket expenses of natural therapies or a holistic approach or even integrative approach to this treatment when the out-of-pocket expenses are so high when you're going through approved, your insurance company is approving it, there's still out-of-pocket expenses that exceed $100,000, which is to your point. Whereas when you go to Arcadia, everything is inclusive, right? I mean, is the ivermectin is if that person, if their body allows it, once you do the research, is that part of your treatment, or do they have to pay extra for these medications, these cinnamon and the berberine and all that?
well,
Is that
if a
part of your
patient,
therapy?
yeah, what a patient gets if she or he sends us a submission and we go through the files and we understand that this is a candidate where we can help the patient to get the disease under control with a reasonable chance of getting a good result, the patient gets a proposal for a 3-week stay. And in this proposal, we mention everything that is included, which is everything we can do, more or less. What is not included would be hospital treatments outside our facility that we don't expect to be necessary. But so what we offer the patient in our initial proposal is an all-inclusive price for everything we're able to bring to the table, inclusive the cost of all the drugs and remedies, and with a take-home package of nutritional supplements and some oral repurposed drugs like maybe ivermectin or maybe mebendazole or a statin or metformin or one of these 30, 40 drugs that you find under the headline of repurposed anti-cancer drugs. They cost approximately a couple of $100 for a 1 or 2 months supply, which is very cheap compared to immunotherapy, where the prices are in the range of 100 times more.
Yes, yes,
A series of treatments with a checkpoint inhibitor, which is a new standard in oncology for a number of diseases, comes with a price tag of around 50 to 100,000 for a couple of months.
yes.
So the drugs we use are much less pricey. It's difficult to compare these two different drugs with each other because there are, of course, no big studies, randomized, double-blind, done with these cheap drugs because nobody is interested to show how effective
It doesn't
they
pay.
are.
Yeah, it
But
doesn't pay.
if somebody here in our audience wants to check out how much literature you find about metformin, please go to PubMed and type in metformin and cancer, and you will find many thousand articles that describe the anti-cancer properties of metformin.
Yeah.
Why does your oncologist not offer you metformin as an add-on metabolic therapy of your disease? Well, because he follows the guidelines, and the guidelines don't mention metformin. Why? Because the guidelines say there is a lack of randomized, double-blind, large clinical trials. Well, the problem is that a box of metformin costs $30 and nobody's interested to promote a drug that is so inexpensive. That's the craziness of our time.
It's criminal, and I'm just going to say it. It's criminal what's happened since Nixon declared war on cancer, because you would think that statistics would go down, but we have increased the cancer recurrence in the United States and in the world. And we just got to stop and say, why? Why? What else can I do? And that's what I love what you're offering, Dr. Henning, at Arcadia Cancer Clinic. And it's an all-inclusive mind, spirit, and body as well. Did you want to add one more thing?
Yes, I want to wrap it up and tell our audience that the approach that we offer includes many, many treatment modalities, and altogether it is a less toxic approach that uses potentially toxic drugs in a much lower dosage so that your quality of life remains good. And we add so many other treatment modalities that address your metabolic problem, like lowering blood sugar, reducing inflammation, helping you with detoxification, etc., so that we can compensate the lower dosage with more metabolic therapies. That's my point with why it is so important with metabolic therapy. Well, first of all, because that's the basis of our health, and we need to work with metabolic therapies to work with the root cause of the disease and not only chop off the peak of the iceberg. But secondarily, it also helps us to reduce the dosage of potentially toxic drugs and help our patients to stay well with a good quality of life. And so it's less toxic and with a broader approach that covers more aspects of the disease than what the standard therapies do. And let me mention two modalities that we use to intensify the efficacy of the drugs that allows us to reduce the toxicity. It's insulin potentiation, low-dose chemotherapy, and hyperthermia as a treatment enhancer. And what that is carefully explained in my book and on the website.
Amazing. And I want to encourage all of you to put your name in the winner's basket by texting me or emailing me. Holistic Cancer Medicine. It's a book for Dr. Henning that he wrote 3 years ago. And also we have the 45-minute if you're interested in learning more and speaking with Dr. Henning. Just text me, email me, and start your journey in learning, just being curious. Just be curious, not critical. Thank you, Dr. Henning Saupe, for being in the classroom. I always love the fact that you make so much sense to me. Even when we were taught differently, it makes so much sense. So thank you so much for doing what you're doing. And I'm looking forward to our next conversation on sugar.
Great. I love
we
it.
can talk for 3 hours about that. And so to you, my listening and viewing friend, please know you're in choice. Don't let a company decide what your body needs. Figure out what the body needs and give it the love that it desires and it deserves. And please remember, we'll be right here waiting for you worldwide at whenyouneedafriend.com. This is Lily McDermott and Dr. Henning Saupe wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.